wondered if it's normal to leak urine after childbirth. Well, watch to the end of this video for some tips that can help. So leaking urine, which is also known as urinary incontinence, is a common issue that many women face after they've given birth, and it can be surprising and something you might not expect, and it can be quite distressing or even embarrassing. Even though it shouldn't be, it's perfectly common. So during pregnancy and childbirth, your body does undergo significant changes. The weight of the baby, the pressure on your bladder can weaken the pelvic floor muscles, and they're responsible for controlling urine flow. There's actually different types of urinary incontinence. The most common after childbirth is stress incontinence. So that's when activities like coughing or sneezing or laughing or exercising put pressure on your bladder and cause leakage. Another type is urge incontinence, and that's where you experience a sudden, intense urge to urinate followed by an involuntary loss of urine. It's less common, but it can also happen after childbirth. So what can you do if you're experiencing this? Well, here's 5 top tips to help you to manage urinary incontinence. First up, the obvious one, do your pelvic floor exercises. Strengthening those muscles through Kegel exercises can be very effective to maintain strength. And there's also apps that you can use to help you to remind you to do your pelvic floor exercises, or there's devices. And ultimately, all these pelvic floor exercises involve repeatedly contracting and releasing the muscles to stop the flow of urine. You should aim to do 3 sets of 10 to 15 repetitions a day, but these pelvic floor exercises are not a cure for everything. If you've already been having issues with urinary incontinence, it may not be enough to stop those problems, and you might need to see a physiotherapist or a urogynecologist. The next tip is to stay hydrated, but make sure you're smart with your fluid choice. Drink enough fluids to be hydrated, but you should avoid having large amounts of caffeine or alcohol. They can be bladder irritants and they can worsen incontinence. And you can look up online other bladder irritants that you should avoid. Next, you should maintain a healthy weight. Easier said than done, but having excessive weight can put extra pressure on your bladder. So maintaining a healthy weight by having a balanced diet, doing regular exercise, can ultimately improve urinary incontinence. Next, you should keep a bladder diary. We suggest a 3-day diary of documenting every time you get an urge to pee, every time you leak urine, also what you're doing and what you're drinking on those days. It can be really helpful when you come to speak to the doctor to have something to show them when it's happening. And finally, bladder training. So sometimes being anxious or getting into bad habits can interfere with the messages that our bladder gets when we need to pass urine. So if you try to urinate, remind yourself to urinate at regular intervals, you can then train your bladder, like setting an alarm so that you go once an hour, and you can then gradually extend the time between those bathroom visits to help to improve your bladder control and reduce how frequently the incontinence episodes occur. If the problems persist, it's important to talk to your healthcare provider, and they can offer you extra treatments. There's loads of options out there. Sometimes it's physical therapy, sometimes it's medications, sometimes it's even surgery. But remember, whilst urinary incontinence is common after childbirth, it doesn't have to be a permanent part of your life. And with the right approach, most women see some improvement. So let me know if you've got any of your own tips to share below.